Good afternoon, everyone. Myself, Dr. Sugandha Agarwal from the Department of Public Health Dentistry, BBDCODS. We'll be taking a lecture on the level of prevention. Contents: introduction, level of prevention, modes of intervention, prevention of the common oral disease, and conclusion. Prevention. What is prevention? Prevention is an action aimed at eradicating, eliminating, or minimizing the impact of disease and disability, or if none of these are feasible, retarding the progress of disability and disease. These are the following: primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Modes of intervention. What is intervention? Any attempt to intervene or interrupt the usual sequence in the developing of the disease in man. Primordial prevention. Prevention of the risk factor in population group in which they have not yet appeared. Efforts are directed towards discouraging children from adopting harmful lifestyles. The main intervention is through the individual and mass education. Examples: national policies and programs on nutrition involving the agriculture sector, the food industry, and food import-export sector. Comprehensive policies to discourage smoking. Programs to promote regular physical activity and making major changes in the lifestyle. Primary prevention. It is defined as action taken prior to the onset of disease which removes the possibility that a disease will ever occur. It envisages the concept of positive health based on the elimination or modification of the risk factor of the disease. The following approaches are recommended by the WHO for the primary prevention of chronic disease. First is population mass strategy. This is directed towards the socioeconomic status, behavioral, and lifestyle changes. High risk strategy: detection of individuals at high risk by optimum use of clinical methods. Secondary prevention: it is defined as action which halts the progress of disease at its incipient stage and prevents complication. Aims to arrest the disease process, restore health by seeking out unrecognized disease and treating it before irreversible changes take place. Reverse communicability of infectious disease. Disadvantage: patient has already been subjected to mental anguish, physical pain, loss of productivity, expensive, less effective than the primary prevention. Tertiary prevention: it is defined as all measures available to reduce or limit impairments and disability, minimize suffering caused by existing departures from the good health, and to promote the patient adjustment to remedial conditions. It extends the concept of prevention into the field of rehabilitation. Primary prevention shows the health promotion and specific protection. Secondary prevention has early diagnosis and treatment. And tertiary prevention is disability limitation and rehabilitation. Health promotion: it is defined as a process of enabling people to increase control over and to improve health. The well-known intervention in these areas are health education, environmental modifications, nutritional interventions, lifestyle and behavioral changes. Specific protection: to avoid disease altogether. Early diagnosis and treatment: it is defined as a detection of disturbances of homeostatic and compensatory mechanism, while biochemical, morphological, and functional changes are still reversible. Though not as effective and economical as primary prevention, but reduces the mortality and morbidity in the certain cases. Mass approach treatment: the rationale is existence of at least 4 to 5 cases of latent infection for each clinical case of active disease in the community. Disability limitation: concept of disability, disease, impairment, disability, handicap. Impairment: it is defined as any loss of abnormality or psychological, physiological or anatomical structure or function. Disability: it is defined as any restriction or lack of ability to perform an activity in the manner or within the range considered normally for a human being. Handicap: defined as a disadvantage for a given individual resulting from an impairment or disability that limits or prevents the fulfillment of a role that is normal for that individual. Disability prevention: it relates to all the level of prevention, reducing the level of impairment, that is primary. Disability limitation, that is secondary, and preventing the transition of disability into handicap is tertiary. Rehabilitation: it is defined as a combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individual to the highest possible level of functioning. Level of prevention for dental caries: it provides a health promotion by through the diet planning, demand for preventive services, periodic visit to the dental offices. Specific protection: appropriate use of fluoride, ingestion of sufficient fluoridated water, appropriate use of fluoride prescriptions, use of fluoride dentifrice, oral hygiene practices. Early diagnosis and treatment, self-examination and referral, use of dental services, disability limitation and rehabilitation, use of dental services. Services provided by the community, health promotion, dental health education program, promotion of research efforts and lobby efforts, specific protection, community award, school water fluoridation, school mouth rinse tablet program, and school spit and fissure sealant program. Early diagnosis and treatment, that is periodic screening and referral, provision of dental services. Disability limitation and rehabilitation, provision of dental services. Services provided by the dental professional, health promotion, that is patient education, plaque control program, diet counseling, reinforcement, dental caries activity test. Specific protection, total application of fluoride supplements, pit and fissure sealant. Early diagnosis and treatment, complete examination, prompt treatment of incipient lesions, preventive resin restoration, simple restorative dentistry, and pulp capping. Disability limitation, complex restorative dentistry, pulpotomy, root canal treatment, extraction. Rehabilitation is removal and fixed prosthodontics, minor tooth movement, and implants. Level of prevention for oral cancer. In this, the health promotion is required and specific protection. Early diagnosis, self-examination, use of dental services, and the use of dental services again in the disability limitation. What is a community provided? Services provided, that is health promotion, dental health education program is must, lobby efforts, oral hygiene aids, and research efforts. Specific protection, demand for legislation to ban tobacco as its product. Early diagnosis, periodic screening, provision of dental services. Services provided by the dental professional, patient education, exhibiting no smoking signs in the clinics, do not provide any ashtrays, strike down the advertisement of tobacco product in newspapers and magazines. Specific protection, removal of known irritants in the oral cavity. Early diagnosis, complete examination, biopsy, oral cytology, and complete accession. Disability limitation, chemotherapy, radiation therapy, and surgery. Rehabilitation, maxillofacial removal, prosthodontics, plastic surgery, speech therapy, and counseling. So at last, prevention is better than cure. Thank you.